Today is a special day in that we are going to be as loving and as generous as possible and provide our services at no charge to those who arrive to the clinic today. Today, the Good Samaritan Health Center of Gwinnett is celebrating its 9th anniversary. We opened in June of 2005, and since that time have provided healthcare services to the poor and uninsured in the Gwinnett County and surrounding areas. We've seen more than 43,000 patients during that time.
So today I'm working with patients, kind of taking them in what we call the triage. So taking blood pressure, getting vital signs, trying to welcome them to the complex here. I think what I'm excited about at the clinic is that we get to really help people who really need help.
This day is pretty awesome because we get to celebrate our 9th anniversary. We've been open for about 9 years now, and also be able to help the patients who really need help. We're offering them free appointments, which is awesome for a lot of these patients who don't get that service very often, so they can come and be seen. And it allows us to minister to them, and we get to witness to them and just help them be touched by grace today.
We have the opportunity to do something that we've always wanted to do, and that's to be able to offer free medical care. And it's just going spectacularly.
We're reminded in the parable of the rich fool not to hoard our material wealth, but rather to be rich toward God. And that's our theme for the day, is to be rich toward God by sharing the resources that He has blessed us with and truly giving to the community at no charge today to help those people that are in circumstances where they might not be able to afford to come here.
Today is that I come to my regular visit because I have several issues in my health, and thanks God, today is for free. I'm very glad that today was a blessing from God.
I feel like today has just been an incredible blessing. There's so many people out there who just do not have health care for various reasons. And while we're sorting out healthcare acts and whatnot, I just love that we have the opportunity to serve those people who fall in between the cracks, and especially giving them free visits. I hate having to turn people away or people not being able to get their appropriate lab work or test because they can't afford it.
I fell and hurt my leg about 6 weeks ago. I've been on my job for 18 years. They cut my hours, and I was fixing to lose my job. Gwinnett Medical said that there was nothing they could do. I need to see an orthopedic specialist. I went out in my car and I prayed, and I made a stop, and that stop sent me here. The doctor that saw me was an orthopedic specialist. I'm leaving here better than I was when I got up this morning and went to the emergency room. I left there with no hope. I'm leaving here with hope.